Hey guys, Hina Sheth here at Rebalance Physical Therapy and Wellness in Philadelphia, Pennsylvania, as well as on the main line in Narberth, Pennsylvania. Today I want to answer the question of, will the trigger points in my pelvic floor ever go away? This is a question that everyone's been asking me. I don't know, it seems like the question of the month. A lot of patients will come to us that have already had pelvic floor physical therapy, and they, say, I had some help, mild help, or nothing has helped, and will these trigger points ever go away? And one of the first things that I ask these patients that are potentially coming to see us is, has anyone talked to you about how the hip, the back, and the pelvis itself, how that has anything to do with the tightness in your pelvic floor? So for those of you who don't know what pelvic floor is, there will be a video at the end that we will also connect you to so that you can learn more about it. However, just a quick little thing. This is the muscles of the pelvic floor. And a lot of people will end up having a lot of tightness in these muscles, and it can cause a lot of various types of genital pain, pelvic pain, abdominal pain, hip pain, you name it. And so oftentimes, people will go and have pelvic floor therapy, and someone will, either teach them how to do a lot of breathing exercises to release these muscles, or they'll actually go physically into the vaginal or rectal area to release these muscles. But that's about it. Now, what we have to say about that is these muscles they're part of a team of a bigger group of muscles. If you imagine your pelvic floor as being like one player on a basketball team, all right? In order to win the game and for everyone to kind of be, coordinated and on the same page, you got to have other players, all right? And if the other players let you down, it's rare that one person is going to win the game. So this is the same idea with the pelvic floor. Just because you go in and you work on these muscles doesn't mean that these muscles are going to stay relaxed or release if there are other muscles that play a vital role in conjunction with the pelvic floor. And there are a lot of muscles that attach to the spine, that attach all around this pelvis, including the back, and even into the hips, which you can't see the bone here, but there's two bones that come down. Pretend my hands are hip bones right here. They come down. There's a lot of muscles that attach from the hip all the way up into the pelvis and the spine, and the abdominal muscles too. And all of these muscles work as a team to allow these pelvic floor muscles to work well. And not only that sometimes, but you also have to consider a bunch of other muscles up into the rib cage, maybe even in the rib cage, as well as your overall posture, and sometimes all the way down into your feet. So I always ask them, has anyone also addressed these other pieces with you? Because that could be playing a big vital role in what is going on with you and your symptoms and all the other things that you might be feeling. So, will my trigger points ever go away? Oftentimes, yes. If you get to the right, if you actually treat the system as a whole, basically, all right? So you have to address things that may be going on in the low back, things that may be going on in the hips. Did you have hip surgery? Were you a sports player? Do you have labral issues? Have you been a bodybuilder and you've been using potentially the wrong abdominal muscles over and over again and built those up, but the deeper abdominal muscles that are really important for coordination haven't been necessarily, you haven't been connecting to them very well to allow that pelvic floor to relax. So yes, trigger points can go away. Oftentimes, you might need additional help. At our clinic, we work with a lot of other healthcare providers to also kind of work as a team to get this team of muscles better. And sometimes not. Sometimes it's just us and we just got to really work on the right things. So it's really, really important it's really, really important if you do have pelvic floor trigger points or pelvic floor tightness, and it's kind of being stubborn, that there are a lot of other factors that you might need to consider. So if you are going through this and you're kind of frustrated and you feel like you're not really getting answers, you've already been to pelvic floor physical therapy, and it's not really, you're not quite where you want to be, then I encourage you guys, if you don't live in and around this area, we do online consultations that can help us kind of really take a look at your history and then guide you either to the right practitioner in your area or allow us to kind of put you on the right path and give you our recommendations. If you live in and around this area, it's a no-brainer. Come see us. And then if you don't want to do any of those things and you live too far away and you can't even get to a pelvic floor PT, then we do have an online program where we go step by step, 40 plus videos, where we take you through how to do this yourself and to balance all these muscles out. Everything is going to be in our information box down below, and hopefully at the end there might even be a link to our program if it's not already on our homepage. So I hope that answers a lot of your guys' questions, and I hope you guys have an absolutely wonderful day. Take care.